Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here in sunny Las Vegas at the Health Conference, interviewing the industry's greatest leaders in health information technology. So tell me, who are you and what do you do?
My name is Justin Schrager. I'm one of the co-founders and the Chief Medical Officer for Vital Software.
So tell me, what does Vital do?
Vital's an amazing system that patients use in the hospital to understand what's going on behind the scenes. So it's a piece of technology they use on their phone while they're waiting in the waiting room, once they've been admitted in the hospital, and now in urgent cares. So it's great.
Yeah, very interesting. So tell me a little bit about your backstory. What's your background and how did you get into this?
I'm an ER doctor by training, and we started the company about 9 years ago to basically make my life easier in the emergency room. So, and by that I mean I wanted my patients to be able to self-service information, their family members to get the information they needed, without the clinicians necessarily having to pop in the room and update them. I saw how the rest of the consumer experience was in the other service industries, and I wanted that for my patients. So that's what we created. Yeah.
Ah, love to hear it. Now, I've been talking with leaders in the space about what they think to be the most underrated challenge in healthcare. What do you think?
The most underrated challenge in healthcare is improving the communication you have with your patients. I can't tell you how valuable it is from a digital brick and mortar investment to spend some time thinking about ways you can better communicate with your patients, because what it's going to do is it's going to make your customers happy, make them happy to be in your health facility, and more likely to return there for future services. It's a bit of a, from the outside, it's a bit of a hard investment. You're not buying equipment, it's not very quick RCM type stuff, but what you're actually doing is you're sort of updating your front door. And I work in the ER, that's the front door of the hospital, and there's no reason why you can't have a digital front door, a real digital front door that is modern and cool, and the patients love it, their family members love it. And I think if you invest in that sort of thing with your patients, they will reward you, essentially, with repeat business and all the other things that come along with it. So.
Makes so much sense. So you recently had an announcement. Can you tell us a little bit about that?
Yeah, so our company is known for improving patient experience, communication in the hospital, in the ER, and the inpatient setting. And we use all kinds of cool technologies to do it. We have moved that outside the hospital into the urgent care setting. So we're really trying to master the acute care visit and provide patients with information that they need when they're sick or when they have an exacerbation of a chronic illness. So.
Such a natural next progression. I love to see it. So what trends are you hearing about in the health hallways?
Oh my gosh, everything has changed this year even compared to last year. I'm hearing talk about agentic systems. I'm hearing a lot of talk about large investments coming into health tech companies. And the thing that I'm most excited by is the general trend towards finding ways to deliver value directly to patients. And that's not something that you see a lot of in health tech. You see a lot of behind the scenes billing, insurance, collections, all that kind of stuff. Technology has been around forever. But now people are talking about how can we use modern tools, LLMs, agentic systems to make life easier for a healthcare consumer. And so that warms my heart because that's what I've been doing for the last 9 years. And it's of course what we do at our company at Vital. But it's nice to see the rest of the other technologists here starting to focus on that too.
So great. Now, while my listeners love to hear about what's happening in this space, they also love to learn from leaders about what drives them. If you could give your younger self a piece of advice, what would you tell him?
Oh my God. Well, like I said, I've been doing this for about 9 years, so I don't think I would have done anything differently. Although in health tech, it's easier to focus on a narrower scope of work and really stick to your guns. So my initial inclination in the ethic of how we do our business is to make sure that patients are treated first and that we don't ask the staff to do one more thing, and that's just how we built our platform. We've stuck to it and it's rewarded us. Frankly, we've had tremendous growth because we've built trust with our customers, which is the health system, the doctors and nurses that use it, obviously the patients using it, and that trust, even though from a health tech startup standpoint, it takes a while to build, and it kind of doesn't sound like a startup type behavior where you're going quick and trying to innovate and break things and do things like that. If you take a step back and you do things that you think are, let's say, the right way to do it, and you stick to it, you'll be rewarded. It just takes a little time.
Love to hear it. Well, thank you so much for joining us today. Where can my listeners find you online?
Vital.io. That's the best place to find me, and of course I'm on LinkedIn. So,
Perfect.
yeah.
Well, thank you so much for spilling the tea with me.
Yeah, thanks. It was great. Thanks for having me.